Perfect. All right. Good evening, everyone. I appreciate you signing up and getting in here today. We'll, of course, allow any others that make their way in, but I do want to appreciate you getting in here and us ready to start. I know that you're giving up time with your families and things of that nature this evening, so we appreciate that you're doing so. I think you're really going to enjoy the webinar this evening. We have Alexis here, and she's going to provide lots of Medicare information, and we can't wait. So just some logistics so everybody knows. If you have a question or a chat, please go ahead and do that here at the bottom of the screen. You can do that. We want to hear from you. You are all muted right now, but that's just to reduce any background noise, not because we don't want to hear from you. We definitely do. And Alexis will be glad to respond to any of those questions there at the end. And so I will go ahead. My name, so sorry, I did not introduce myself. My name is Sherry Scott. I'm with Partner Colorado Credit Union. I am the financial education manager here at the credit union. I handle all of these types of webinars, really any financial education need that you might have, you can come to me. I will add my name and email and phone number there in the chat. So if anyone wants it, it's there. Otherwise, I'm going to go ahead and hand it over to Alexis, and I appreciate you all this evening.
All right, perfect. Well, thank you so much. Okay, so as Sharice mentioned, my name is Alexis Pepple, and I am a Medicare insurance broker. So what in the heck does that mean? So what I am is I am contracted with all of the major insurance carriers. So I work with United, Humana, Aetna, Anthem, Mutual of Omaha, Cigna, all the major insurance players. And what I really do is I help people soup to nuts figure out the alphabet soup, the Medicare maze that happens when you turn 65, or say when you retire and you come off of a group plan and need to look at Medicare as your health insurance. So what I do is I can help you get enrolled in A and B, look at all the additional options for insurance, and guide you through what's going to be best for you and help get you enrolled. And then as you transition on to Medicare and every year have open enrollment, which we're in right now, make sure that every year going forward, you've got the best plan. One thing I like to mention, a lot of people don't realize that there are people out there like myself. It does not cost anything to work with me. I'm compensated by the insurance companies and they all pay the same. So I don't bleed any specific color, right? United Healthcare blue or Humana green or Aetna purple. I really want to do what's best for you and based on your needs. So what I'm going to do today, and really quickly, I'm located here in Parker. I'm in Colorado, but I am licensed in 25 states. I've got clients all over the country as far as Medicare goes. So whether you're here in Colorado today, or maybe say you have family, friends, colleagues in other states that are kind of going through Medicare open enrollment or getting ready to turn 65, please jot my contact information down. I'm more than happy to help them. I work with people all over the country. What we're going to do today is what I call my Medicare 101. So we're going to go through the alphabet soup. We're going to talk about what's covered, what's not covered, some of the costs associated with Medicare. And then at the end, we will have questions. So there is at the bottom, like Sharice mentioned, the Q&A and the chat box. And so I'll do my best to go through those and answer questions that you might have as we go along. And then I will definitely get through all of them at the end. All right, so let's dive right in. So what is Medicare? Let me explain what Medicare is. Medicare is a federally funded health insurance program. Okay, it's the federal government's program for those that turn 65. Medicare is funded in part by your tax dollars. So that little Social Security deduction that's coming out of those paychecks, little piece of that's going into the Medicare pot for future healthcare costs. So it's funded by those tax dollars. One thing with Medicare, and people sometimes don't realize this, is it's completely individual. A lot of people are used to being on a group plan, say with an employer where you've got your spouse on it, maybe you have some kiddos, your dependents on the plan with you. When you move on to Medicare, it's completely individual. So I've got clients where maybe one spouse is on a Humana plan and the other spouse is on a United Healthcare plan, because it's individual. You can pick and choose what you want specific for you. That also means that the premiums and some of the costs associated with Medicare are individual. So I'll mention that again when we look at some of those costs. So going over to the not column, it's not a family health plan, right? If you've got, maybe children that are under the age of 26 that are still eligible to be on your health plan, if you transition to Medicare, they can't be on that plan with you. You can't have a spouse on that with you. Medicare is not the same as Social Security. A lot of people think that you have to be taking that Social Security benefit in order to be eligible for Medicare, and that's not the case. you can go on to Medicare at the age of 65 and continue to delay that Social Security benefit to full retirement age or beyond, so that you get the most out of that benefit. Medicare is not the same as Medicaid. A lot of people think those are similar. Medicare is the federal health insurance program. Medicaid is the state-specific program. Here in Colorado, our Medicaid program is called Colorado Health First. Out in California, it's called Medi-Cal. And just like it sounds, it's a form of financial aid for those that don't have the financial means to pay for all of the costs of their Medicare insurance. So you do have to qualify. It's based on your income, the assets you have. Do you own a home? Do you own a car? And if you qualify, then Medicaid would step in and supplement your Medicare insurance to make sure that you've got the coverage that you need if you can't afford it. Obviously, we know there's no such thing as a free lunch. Medicare is not free. We will talk through what some of the costs are as far as what's associated with Medicare, but Medicare is not free. So who can get Medicare? How do you become eligible for Medicare? So for most people, it's turning 65, right? You turn 65, happy birthday, you are now eligible for Medicare. One of the requirements, because it's a federal health insurance program, you do have to be a US citizen or a legal resident, okay? But like I mentioned, most people are gonna age in at 65. Welcome to Medicare, you're 65. You can qualify for Medicare prior to the age of 65 if you have a qualifying disability. So if you are disabled in the eyes of Medicare, you can qualify for your Medicare benefits prior to the age of 65. The rule is you've got to be disabled for at least 24 months, so 2 years. In that 25th month, you would be eligible to take those Medicare benefits again prior to the age of 65. The other way that you can qualify for Medicare prior to the age of 65, and I hope this doesn't apply to anybody, but if you're diagnosed with end-stage renal disease, so kidney failure, or Lou Gehrig's disease, ALS. But for most people, it's going to be turning 65, you're aging in, you're now eligible for Medicare. So what does Medicare cover? Let me start to dive into that alphabet soup. So original Medicare, remember the federal health insurance program, that's what I'm going to refer to as original Medicare, that red, white, and blue card that you see up on the screen there. It's made up of two parts. You've got your Part A and your Part B. Part A of Medicare is what helps pay for hospital stays and any inpatient care. And for most people, Part A is quote unquote free because you've already paid for it. That little Social Security deduction that was coming out of your paycheck, little piece of that goes into the Medicare pot for those future healthcare costs. So Part A is free because you've already paid for it. The way that you qualify for premium-free Part A is if you have satisfied those 40 quarters, paid those taxes for 40 quarters, 10 years, then you qualify for free Part A. Let's say that I stayed home and I was the domestic engineer, the coordinator of chaos, if you will, at the home, and my spouse worked outside of the home. As long as my spouse has worked for at least 10 years and satisfied those 40 quarters, and I've been married to that spouse while they were doing that, then I also would qualify for premium-free Part A. If for some reason you did not qualify for premium-free Part A, the premium is right around $425 a month. It's pretty steep. But most people, by the time they turn 65, they can check that box a couple times, right? They've worked for those 10 years. Part B of Medicare is what helps pay for doctor visits and any outpatient care. Part B does carry a monthly premium, and I'm going to show you those premiums on the next slide. The way that they determine those monthly premiums is they're going to look back 2 years. So in 2021, they're going to go pull your tax return from 2019. They're going to look at what your taxable income, your modified adjusted gross income was, and base your Part B premium off of that. And I'm going to show you that on the next slide. The way that original Medicare works, if you were to only hold this red, white, and blue Medicare card, which I would never recommend to anybody, but the way that it works is it's an 80-20 plan, meaning Medicare is going to pick up 80% of the cost of your care. You are going to be on the hook for 20% of the cost of your care. So you go to the doctor, you go to the hospital, Medicare covers 80%, you're on the hook for 20%. And there's no limit, there's no out-of-pocket limit that you reach where they say, okay, you've spent enough. There's no limit there. The way that you enroll into Part B of Medicare is through the socialsecurity.gov website, okay, ssa.gov, Or right now, because the Social Security offices are still closed, you can call Social Security and set up a phone appointment to apply for your Part B. But really the easiest way is to do it online. And we'll talk a little bit more about enrollment periods and when you would want to apply. So original Medicare, federal government, Part A, Part B. A is hospital, B is doctors, A is free, Part B has that monthly premium. So let me get to the monthly premium. Everybody's interested in the numbers, right? So when you go onto Medicare, you've got to pay for that Part B. So the way they determine it, like I mentioned, they're going to look back 2 years. They've not yet published what 2022 premiums, next year's premiums are going to look like. So these are still this year's. They'll probably publish those pretty soon. My anticipation is early November. So the way to read this chart is to think back to 2019. Did you file an individual tax return, a joint tax return, or you're married filing a separate return? You're going to find that column that's applicable to you. And then again, thinking back 2 years ago to 2019, what was your taxable income, your modified adjusted gross income? So let's just say an example that I'm married, I file a joint tax return, and let's say that I was wildly successful and I made $300,000 back in 2019. So I'm going to look in that middle column. I'm going to go down 4 squares there to that income bracket of 276,000 up to 330. I'm going to follow that out to the right. My Part B premium that I'm going to be paying each month is going to be that $386.10. That's what I'm going to be paying every month for my Part B. If my spouse was also on Medicare, that's the premium that he would be paying as well, right? Because Medicare is completely individual. So that's the Part B premium. I've got that funny little blue box over there on the right with that IRMA, sounds like a hurricane. IRMA stands for an income-related monthly Medicare adjustment, income-related monthly Medicare adjustment. And I've done the cheater math there so that I don't embarrass myself on the fly in front of you trying to do the math. But what that IRMA is, it's an adjustment above the base amount. The base amount this year is $148.50 compared to what I would be paying at that $386. It's a difference there of that $237. So I'm going to pay that income adjustment of $237 because I was making $300,000 2 years ago, okay, because they look back 2 years. This Part B premium will change every year as your income changes. So let's say that I'm turning 65 today and I'm going on to Medicare, and they're going to look back 2 years when I was still working and getting that income, that paycheck, and base my Part B premium off of it. But I'm retiring today, that paycheck is ending. So next year in 2022, my income is going to look very, very different than it did back in 2020, right? Because in 2022, they're going to look at my 2020 tax return. I was still working. So what you can do if you fall in one of those higher income brackets and you have one of these IRMAs, there's a form out there, and I've got it indicated in that bottom left-hand corner. There's a form out there called the SSA, Social Security Administration 44, SSA 44 form. What that form is it's called the life-changing event form. And the way that you use that is I would file it with Medicare when I file my 2022 tax return, showing them, hey, Medicare, can you please look at my most recent tax return instead of looking 2 years back? Because my income is very different than it was 2 years ago because I'm not working anymore. And a life-changing event is work stoppage. So for those of you that have an IRMA, this is a really key form to help soften the blow of that higher Part B premium because they're still looking back at the years that you were working. Happy to chat through any of that and when to file that form and how to kind of protect yourself from those higher Part B premiums, but just wanted to call that out. As far as what to anticipate for next year with the Part B premiums, they tend to go up about 5% per year. I'm anticipating that $148.50, that base amount, it's going to look more like $155 next year. So they typically go up about 5% each year. Okay, so that's the Part B premiums. If you're lucky enough to have one of those IRMAs because you were a high income earner 2 years ago, the government is going to hit you twice. They're going to give you that little IRMA on your Part B, and they're also going to give you this little IRMA on your Part D, your drug coverage of Medicare. So again, the way to read this is thinking back to 2019, I was married, filing a joint tax return, making $300,000 a year. I'm going to pay an IRMA, an income-related monthly Medicare adjustment, of $51.20 in addition to any Part D, as in drug, premium that I might be paying. Okay, so you've got that Part B IRMA and the Part D IRMA if you have that higher income. And again, this will change each year as your income changes because they always look back 2 years. 2021, they're looking at 2019. 2022, they're going to pull 2020. 2023, they're going to pull 2021. Okay. All right. I mentioned Medicare doesn't cover everything, right? It's an 80-20 plan. Obviously, it's not going to cover all the costs of your care. You are going to have some out-of-pocket costs that you are responsible for. Again, the big one there is with no limit. Original Medicare, Parts A and Parts B, do not cover prescription drugs. That's why you've got that Part D plan out there. They don't cover ancillary benefits like dental, vision, hearing aids, glasses, all those ancillary extra shiny benefits, right? One really important thing to understand, Medicare does not cover any type of long-term care. Long-term care is going to be that custodial care, those acts of daily living, right? Eating, bathing, going to the restroom, dressing yourself. Long-term care is covered specifically under a long-term care policy. That's where your financial advisors are a great resource to you because they're the ones that do the long-term care insurance. Medicare is not going to cover any of those types of things. Medicare, original Medicare, is also not going to cover you if you travel outside the US. So how do we fill in the gaps? Where do we get additional coverage to really round out that Medicare insurance, right? One joke that I make when you go onto Medicare, death, taxes, and Part B premiums. Everything that we've talked about to this point in the presentation has been federal government. Those Part B premiums you're paying to the government for your original Medicare, there is nothing that we can do about those. Everything that we're going to talk about from here on out is going to be private insurance companies, the United Healthcares, the Humanas, the Anthems, the Aetnas of the world. Once you're on your Medicare Part A and Part B, you have 2 options for additional insurance. So option 1 in the red box, what this represents, that top box, is a Medicare supplement plan. And then a standalone, that second box, a Part D prescription drug plan. Supplement plans, some people might know them as Medigap plans. Supplement plans are going to be those letter plans. So Plan F as in Frank, Plan G as in George, Plan N as in Nancy are really kind of the 3 supplement plans on the market right now. There are about a dozen of them. The ones that really are worth anything as far as benefits are F and G and N. Plan F as in Frank was retired back in January of 2020. So anybody turning 65 after that date is not eligible for F. The plan you'd look at is Plan G as in George. That's the Cadillac plan, if you will, currently on the market for supplements. So I'm going to talk about Plan G. The way that Plan G works is Medicare is your primary insurance, that red, white, and blue card. That supplement Plan G comes in and sits on top of it as a rider to cover those out-of-pocket costs, to pick up those 20% that original Medicare is going to try to leave you with. From a cost perspective, supplement plan insurance feels really, really similar to car insurance, right? You pay a monthly premium, you back up into somebody at the King Soopers parking lot, you pay your deductible, they fix your car, you keep paying your premium. Kind of how a Medicare supplement plan works. You're going to pay a monthly premium based on where you live, your gender, smoker, non-smoker, and how old you are. So for me, 65-year-old non-smoking female, I'm in Parker, Douglas County, I would pay about $120 a month for supplement Plan G. That would be my monthly premium. Again, in addition to that Part B premium, right? And any IRMA if I have that because of my income. So I pay my monthly premium for supplement Plan G. The only other out-of-pocket cost that you would have is the Part B, as in boy, deductible. And remember, Part B of Medicare is what covers doctors. So the first time I go see my doctor, I satisfy that $203 deductible. I keep paying my premiums. I will not get a bill from a doctor or a hospital. That's it. There's no copays. I just pay my premiums. Everything else is picked up. Okay, so that's how a supplement plan works. Supplement plans don't cover prescription drug. That's why I've got that Part D, that drug plan in there. Average cost of a drug plan is about $30 a month. Okay, it can range as low as $7, as much as a little bit over $100, but average cost is about $30 a month. It's going to depend on what prescriptions you take. So you'd have that monthly premium, and then you'd have any copays when you go pick up your prescriptions at the pharmacy. So option 1, you've got your Part B premium, your supplement plan premium, and your prescription drug plan premium. The type of person I recommend option 1 for is somebody that I sit down with and they go, gosh, you know, Alexis, I'm in and out of the hospital, frequent flyer to the emergency room. I've got a list of medications longer than my arm, lots of specialists. They're dealing with chronic health issues. They've got a lot going on medically. The reason option one is good for somebody like that is because they know exactly what their healthcare costs are going to be, because they know exactly what those premiums are going to be every month for the year, right? So you can sit down and very easily budget that into your plan for the year of what your healthcare costs are going to be. Okay, so that's option one. Important thing to remember there, Medicare is primary, your supplement plan is secondary. You're in the Medicare network of doctors, hospitals, and providers. If Medicare says yes, your supplement plan says yes. If Medicare says no, your supplement plan says no, okay? Medicare is primary. Option two in the blue box, what this represents is a Medicare Advantage plan, or what's known as Part C of Medicare. This is every commercial on TV right now, okay, is Medicare Advantage plans. The way that a Medicare Advantage plans work is the insurance company that manages your plan is your primary. So if you're on a Humana Medicare Advantage plan, you're going to play in the Humana sandbox of doctors, hospitals, and providers. They're your primary insurance. What they're going to do is they're going to combine all of your A and B benefits into one consolidated plan, include your prescription drug coverage, that Part D, into that plan, and then include all those shiny Joe Namath benefits, the dental, the vision, the hearing aid, the travel outside the country coverage, okay? All in one consolidated plan. From a cost perspective, the way that a Medicare Advantage plan works is there is no monthly premium and there is no deductible, or it's very, very low, much lower than a supplement, but typically there's no monthly premium and no deductible. But we all know that there is no such thing as a free lunch. So the way that you pay for a Medicare Advantage plans is there are co-pays when you use the benefits of the plan. So if you see a specialist, if you're in the hospital, if you find yourself in the emergency room, you will pay a copay according to your plan. But it's not death by 1,000 copays. There is a maximum out of pocket that if your health was to, fall off the rails and kind of take a left turn in the course of the year, your plan's going to say, okay, Alexis, you've reached that maximum out of pocket in those copays. We're going to stop it. We're going to pick everything up at 100% for the rest of the year. Okay. So option one, you pay that monthly premium, whether you see a doctor or you don't. Option two, you only pay a copay if you use the benefits of the plan. Okay. Option one, Medicare primary. Option two, insurance company is primary. The average out-of-pocket cost here in Denver Metro for a Medicare Advantage plan, right around $4,000 for the year. Okay. The specialist copays, the ER copays, they're pretty minimal. Happy to review that with anybody if you want to take a look at one of those. Type of person I recommend option two for. Somebody I sit down with and they go, gosh, I'm on atorvastatin for my cholesterol, lisinopril for my blood pressure. I'm just kind of on some maintenance medications, levothyroxine for my thyroid. I need to get a knee replacement in a year or two, but I kind of just do my annual stuff. If I need to see the cardiologist, I do. They're not dealing with a lot of chronic health issues, right? So they're going to save quite a bit of money not paying that monthly premium, because there might be months where they don't see the doctor, where they're not in the hospital, right? So I kind of say it's my healthy hiking, biking seniors. Those are the type of people that I recommend option two for. The next question that's brewing in your mind is, okay, well, Alexis, I am the poster child for option two right now, but 10 years down the road, I have no idea what my health is going to do or how it's going to change. What if I want to go back over to option one? Okay, let me talk about switching. When you go onto Medicare for the first time, okay, so you're either turning 65 and you're going on to Medicare, or you're retiring, you're coming off a group plan. But when you go on to Medicare for the first time, you have something called guaranteed issue. Guaranteed issue. It's important with option one on a supplement plan, because during that 6-month window, you can apply for a Medicare supplement plan and you don't have to reveal anything medically about you. You don't have to go through underwriting. You don't have to open the kimono and reveal that you're on a statin for cholesterol, or that you were in the hospital 2 weeks ago, or you need to get knee replacement surgery in 3 months. You don't have to go through any underwriting. But once you're outside of that 6-month guaranteed issue window and you want to apply for a supplement plan under option one, you are going to have to go through that underwriting. You're going to have to let them know what's going on with you medically. If you don't have anything going on, then great. They're going to say, perfect, Alexis, you're just normal for your age. We're going to give you your supplement plan premium is going to be based on where you live, your gender, smoker, non-smoker, and how old you are. Perfect. Welcome aboard. Or they're going to say, well, gosh, Alexis, you're on a statin for your cholesterol. That's a little bit of a red flag. We're going to insure you, but you might be a little bit more risky. So we're going to increase your premiums a bit because of it. Or worst case scenario, they're going to say, oh gosh, Alexis, you're in the middle of breast cancer. No, we're not touching you with a 10-foot pole. You're going to cost us way too much money. We're not going to insure you on a supplement plan under option 1. Option 2, Medicare Advantage plans, never, ever, ever is there underwriting. You could be inside guaranteed issue. You could be outside of your guaranteed issue window. You're never going to have to answer any health questions to qualify for a Medicare Advantage plan. Okay. So a lot of people ask about pre-existing conditions. Pre-existing conditions don't apply within that 6-month window, that guaranteed issue window under option 1. They never, ever apply with a Medicare Advantage plan. Very easy to go from option 1 to option 2. Potentially can be somewhat difficult to go from 2 to 1, depending upon how you answer those health questions. Okay, that's the meat and potatoes of the presentation. So it's all kind of, we're going to slide into home base from here. Let me talk about this donut hole or this coverage gap that has to do with prescription drug coverage when you're on Medicare. So whether you are on option 1 and you have that standalone Part D plan, or you're on option 2 and your drug plan is built into your Medicare Advantage plan, these 4 stages of drug coverage apply. These are dictated by the government. So let me explain what they are. The first stage is the annual deductible phase. So let's just say, for instance, my drug plan has a $100 deductible. So I go into the pharmacy to pick up my prescriptions. I'm going to take $100 out of my pocket to meet that deductible. Then I'm going to skip over into the initial coverage phase. In the initial coverage phase, I'm going to pay a copay for my prescriptions based on the benefits of my plan. So let's say that I'm on a medication that retails for $100. That's what it costs. But according to my plan, my copay is $10. So I go walk into the pharmacy and they say, great, oh, here's your prescription. I give them my $10. My plan picks up the other $90 to cover the $100 cost. I'm going to stay in that initial coverage phase till my total drug cost, what's coming out of my pocket, what the plan is picking up, reaches $4,430. These are next year's numbers, 2022. $4,430. Then I skip over into that donut hole, or really what's called the coverage gap. What happens in the coverage gap is you now pay 25% of the cost of any of your prescriptions. So that prescription that was $100 in the initial coverage phase and I was paying $10 for, I'm now going to pay 25% of that $100. I'm going to pay $25 for that prescription when I fill it. I'm going to stay in that donut hole until my out-of-pocket costs, so just what I've spent out of my pocket to date through these phases, reaches $7,050. Then I hop over into the catastrophic coverage phase. In the catastrophic coverage phase, my drugs get much more affordable. I'm going to pay either $3 for generics, $9 for brand names, or a 5% coinsurance for those really, really expensive tier 5 prescriptions. About 1% of the population gets to the catastrophic coverage phase. Most people stay in that initial coverage phase. But this is why it's so important every year to reassess your prescription drug plan, because this cycle runs a calendar year, January 1st to December 31st. Every year, drug plans change. The premiums will change. The formularies will change. Every plan has its own formulary of drugs that are covered. And the drugs are classified by tier 1 through 5. Tier 1 are going to be those generic prescriptions. Tier 5 are going to be those more expensive prescriptions. One drug plan might have it as a tier 2. One drug plan might have that same drug as tier 3. So really important to review your drug plan every year. Again, something I can help you with. Very, very easy to change drug plans. There is never any underwriting. You don't have to answer any health questions. You just go ahead and submit an application. It's very, very easy to change. So now that you are all so excited about Medicare, when can you enroll? Let's talk a little bit about the election periods and enrollment periods. Like I mentioned, most people become eligible for Medicare when they turn 65. What happens when you turn 65 is you have your initial enrollment period, your IEP, initial enrollment period. This is a 7-month-long window where you can get enrolled in your Medicare Parts A and Parts B. So again, let's use the example of I'm turning 65 today in October. So let's put that big red dot right on the month of October. My initial enrollment period opens up 3 months before my birthday. So July, August, September, the month of my birthday, October, November, December, January. That's my 7-month long initial enrollment period where I can get enrolled in A and B, decide whether I want option 1 or option 2. Okay. So this just happens when you turn 65. Medicare only sees 12 days a year. They only see the first of every month. So even if my birthday was today on October 19th, my Medicare would actually kick in on October 1st. The only loophole to that is if your birthday's on the first of the month. If my birthday was October 1st, my Medicare would actually kick in September 1st, the first of the month prior. Okay. Typically what you would do is you would line everything to hit October 1st, the month that you turn 65, but they do give you that 3 months on the end just to kind of keep bumping that Medicare down on the to-do list because it's not the most exciting topic, on people's to-do list. So this is your initial enrollment period. This is a visual representation of that Medicare supplement open enrollment period, that idea of guaranteed issue, right? Remember that first time that you go onto Medicare, whether it's you're turning 65 and going on to Medicare, or let's say you're retiring at 68 and you're enrolling in your Part B for the first time. This is that 6-month window where you do not have to go through any medical underwriting. You don't have to answer any health questions to be eligible for a Medicare supplement plan, option 1. That's that visual representation. What happens if you work past 65? Okay, let's play out a scenario. Let's say that I'm 65 and I'm working for the credit union and my husband is only 63, okay? And I carry our insurance and I'm gonna continue to work for a couple of years. And I say, well, you know what, since I'm gonna continue to work, I'm gonna stay on the work plan so my husband can have that insurance too. And we'll both go on to Medicare when I retire in 2 years and my husband's 65. So those 2 years go by, it's now the middle of July and I've decided I'm done, I'm ready to retire. I am now gonna have a special enrollment period, okay? My initial enrollment period kind of just rolled by me. I didn't do anything because I wasn't choosing to go on to Medicare at the time. So now I'm gonna have this special enrollment period. What's gonna happen is, let's say I'm retiring in July. So my health insurance, the credit union, is gonna end at the end of July. So what I would do is I have 8 months, August, September, October, November, December, January, February, and March to get enrolled in my Medicare Parts A and Parts B. Why you would wait 8 months, not quite sure. Maybe I was just an amazing employee and they said, gosh, Alexis, we'll pay for your health insurance for 6 months. Maybe I take advantage of that. But typically you're going to lose insurance on July 1st or July 31st. And then you're going to have your insurance kick in on August 1st, rather. Typically, there's no lapse in coverage, but you technically have 8 months, again, to get enrolled. Once you've enrolled in your Part B, the clock resets. That's that bottom bar. The clock resets. And now you have 63 days. You've got 2 months to decide whether you want to do option 1 or option 2. Again, typically, you're going to kind of decide all of this at the same time, but technically, according to Medicare's rules, you've got some cushion where you won't incur any late enrollment penalty. So this is what happens if you work past 65. This is regardless of the time of year. So you don't need to try to time your retirement with open enrollment for Medicare. You don't need to, try to time it with anything specific. This is regardless of the time of year because it's a life-changing event, right? You're coming off that employer plan. Okay. Let me talk a little bit about late enrollment penalties. So when you turn 65 and you become Medicare eligible, you can choose to delay enrolling into your Part B if you can prove to Medicare down the road that you have had credible health insurance coverage since becoming Medicare eligible, since turning 65. Okay, couple of things that are very important to understand. Credible coverage is coverage that is equal to or better than what Medicare offers. Okay, couple of things that are not considered credible coverage. COBRA. COBRA is not considered credible coverage. If you are 65 and you are on COBRA, you are starting to incur a late enrollment penalty because COBRA is not credible coverage. Connect for Health Colorado, insurance plans off the exchange. They are not considered credible coverage. You have to go on to Medicare. You can't choose to buy an insurance plan off the exchange. Federal employee health benefits, not considered credible coverage. If you're in a federal employee and you're covered under the federal employee health benefit plan and you do not enroll into your Part B, you will start incurring a late enrollment penalty. The other one that's not considered credible coverage is if you work for an employer that has 20 or less employees. Even if they offer you health insurance, it's not considered credible coverage. Okay, so if you work for a smaller company, you have to go on to Medicare at the time you turn 65. Otherwise, again, you'll start incurring these late enrollment penalties. So what are the late enrollment penalties? Medicare Part A. Really, I've run into this one time in all the years I've been doing this, because most people qualify for free Part A because they've worked those 10 years. If for some reason you didn't, the way they figure out your Part A penalty is going to be based on how many quarters you've satisfied, right? How many of those 10 years you've actually worked and paid taxes. And depending upon how many you've satisfied, they're going to kind of run the numbers a bit differently. But that 10% that's up there is going to be the 10% of that Part A premium, what it would be for you, depending on how many quarters you qualified for. And then they'll implement that penalty again for a certain period of time based on how many of those quarters you satisfied. Okay, so it's a little bit kludgy, the Part A penalty. The Part B penalty is very clear. For every year that you do not enroll in Part B and you cannot prove to Medicare that you've had credible health insurance coverage, you will get a 10% penalty. The 10% penalty is going to be based on whatever your Part B premium was. So if it's that base amount, that $148.50, or if it's that $397 because I had that higher income, it's going to be 10% of that. What they're going to do is they're going to tack that penalty on to your Part B premium in perpetuity. You're going to pay that penalty every single month for the rest of your life. They're very mean with their penalties. It's not a one-time late to the party. You're going to pay for it for years and years to come. Medicare Part D penalty. So back in 2006, Medicare passed a law that when your A and B of Medicare are active, you are required to have prescription drug coverage, even if you do not take prescription drugs. So when your A and B are active, you are required to have prescription drug coverage, even if you don't take prescription drugs. What happens if you do not enroll in prescription drugs? For every month that you don't have drug coverage, you are going to start accruing a 1% penalty. It's 1% of the average cost of a drug plan. Average cost of a drug plan right now is about $32.50. So you're going to pay a 32-cent a month penalty. What's going to happen is for however many months you don't have drug coverage and your A and B are active, when down the road you decide, gosh, I got put on Eliquis, I can't afford that. It's a very expensive prescription. I need to get on a prescription drug plan. Once you enroll in a drug plan, they're going to accumulate, they're going to accrue up add up what you've accrued over the months. And they're going to tack that penalty onto your prescription drug plan premium in perpetuity. Okay. It seems silly, but I've had clients where they enrolled in a supplement plan, option 1, 10 years ago. They got referred to me a couple years back and, hey, we need to look at a drug plan. Great. Let's look at a drug plan. What are you on? Oh, we aren't on one. Oh gosh. Okay. Well, over that 10 years, they've racked up that penalty. They each now have a $50 a month penalty that they're paying every month for life because they didn't know that they needed drug coverage 10 years ago when they enrolled in Medicare. Okay. When can you change your coverage? Just so happens we are smack in the middle, or at the beginning really, of open enrollment. Every year, Medicare beneficiaries are going to have open enrollment. It runs October 15th through December 7th. This is when you can look at your current plan, look at the new plans coming out for 2022, and you can assess, do I want to make any changes? If you like the plan you are on, you do not need to re-enroll in that plan. It will automatically roll over into next year. The only reason you need to do something during this little time frame of October 15th through December 7th is if you want to make a change. If you want to make a change on your drug plan, if you want to go from a supplement to an advantage plan, then you would make that change during this time frame. Any elections you make during this time frame go into effect January 1st. So any elections you make go into effect January 1st. All of the plans run a calendar year. Okay. So every year you're going to have this. One thing I like to call out that a lot of people are not aware of is this Medicare Advantage open enrollment period. The first 3 months of the year, so January, February, and March, anybody that is enrolled in a Medicare Advantage plan, option 2, that Part C, has one time to change either to a different Advantage plan or back to original Medicare with a prescription drug plan. Why would you need this? All of you that are on Medicare right now are getting harassed daily. Calls, solicitations, commercials, mailings. Let's say during open enrollment, somebody calls you and they say, hey, Alexis, This plan is going to be the best plan for next year. It's got every benefit you ever need. It's just, I mean, it's blowing everybody out of the water. And I'm like, yeah, I got to have the best plan for next year. So I go ahead and I enroll in that plan during open enrollment. January comes around. Okay. I've got an appointment with my dermatologist. I go into my dermatologist and I'm so proud. I slap my new card down and I go, I'm in the best plan on the market. They go, well, no, you're not, because we're not in that network. You can't see me unless you want to pay 100% of the cost. Oh my gosh, I got sold. I totally got hoodwinked. That's why you have this special enrollment period, because now I've got one shot to say, you know what? I got suckered into this plan. I want to go back to my old plan. I can make that change. Okay. So just want to call this out because a lot of people don't realize that this is around there. This is only for people on Medicare Advantage plans, option 2. This is not applicable to those supplement plans under option 1. Okay. Last slide, guys, and then we'll get to questions. Special enrollment periods if you have a qualifying event. So if you have a special event, a special qualifying event, you're going to have this election period, again, regardless of the time of year. So the 2 big ones I see is coming off a group plan, right? You're retiring, you're losing that employee health coverage, or you move. A lot of people right now are taking advantage of the real estate prices and they're cashing out, they're downsizing, they're moving. So if you are to move in the middle of the year, say you move in the middle of May, you would have an election period to look at the plans that are available where you move and see if you need to make any changes. Advantage plans, option 2, they're county specific. So I live in Douglas County and Parker. Let's say I decide to move down to Colorado Springs, El Paso County. The plans are different down there. I would have an election period to look at the plans that are available down there and get on a new plan in the service area that I now live with. Okay, so if you move, you have this special election period. If you were to have a qualifying, if you qualify for a special needs plan, special needs would be, let's say that you are diabetic. There are special needs plans out there for people that are diabetic. If you move in or out of an institution, there are special plans out there for people that live in a nursing home. Okay. If your financial situation changes and you now qualify for both Medicare and Medicaid, there are special plans out there for Medicare, Medicaid, what's called a dual beneficiary. I know I didn't talk a lot about Medicaid in this presentation, but if anybody does have questions on Medicaid, I can help you navigate that. I do know about Medicaid. It just tends to be a little bit more narrowly focused than kind of this general presentation. But the 2 biggest qualifying events or special enrollment periods are moving and coming off an employer plan, or what I see. All right, you guys, that is a ton of information. I know it feels like drinking from a fire hose, but you've made it to the end. My contact information is up here. The list of states that I'm licensed in, there may be 1 or 2 of them missing, but like I said, I am licensed more or less all over the country. Again, if anybody wants to set up a review and look at their coverage, I am more than happy to do that. If you're where you need to be, I'm not going to move you. I'm not high pressure. I'm not into moving people to move people. If we can do you something better for next year, great, then we can do something better. Again, doesn't cost anything to work with me. And now I will open it up for questions. And I see Sharice put her contact information in the chat there. So you've got that if anybody needs that. So go ahead and fire away if anybody's got any questions. You can use that little chat button down at the bottom or the Q&A button down at the bottom, whichever you prefer. Because there's a quiz later, and if you don't pass it, you can't leave the WebEx. No.
Holding you hostage.
And if anybody has any specific questions that they don't want to bring up, kind of in the broader audience, please feel free. Email really is the best way to get a hold of me right now. I'm a little bit of a chicken with my head cut off because it's open enrollment. So the best way to get a hold of me is via email, and I'm pretty responsive as far as getting back.
I think that's how you do that, Alexis. Sorry, Bob, go ahead.
I've got a question. I guess I might have something just opened my eyes the last 5-10 minutes. I am covered under a federal plan, and I'm turning 67 tomorrow, but I am still working. If I heard you right, does that mean I'm already incurring a 20% penalty if I would apply or enroll in Part B tomorrow?
Correct. So since you turned 65, yeah. So really, Bob, kind of what it is when you're a federal employee, They want to move you from one balance sheet to another. They want to move you as an expense onto another federal program. So they want to move you from your employer plan over to the Medicare expense line. So yes, if you were to enroll in Part B, you would incur a late enrollment penalty because Medicare is not going to view that federal employee benefits program as credible health insurance coverage. Are you on Blue Cross Blue Shield or are you on Kaiser? Kaiser. Yeah. So here's the thing though, Bob, it's not all bad news. Okay. You can choose to never enroll in Part B and just stay on your federal employee plan for all of time. The risk there, the federal employee benefits are not guaranteed. If they were ever to go away, which, you know, they've been around for years, but you know, you never know what's going to happen. I mean, if I had the crystal ball, I'd be on an island with the winning lotto numbers. But you can choose to never enroll in Part B and stay on that federal employee benefits program. Just know that down the road, if something ever were to change and you had to enroll in Part B, that you would have that late enrollment penalty.
I knew that I could stay on my federal benefits plan and not enroll in Part B. I just didn't realize I was already under penalty since I turned 65.
Yeah,
So that was new.
yeah. I tend to recommend, Bob, people enroll in Part B just as a safety net. Continue to stay on your federal employee benefits program. You could stay with the Kaiser plan, but I tend to advise people to enroll in Part B, even if they're going to stay on that federal benefit plan, just because you never know what's going to happen down the road.
But then I'm paying.
That's the catch.
Twice for insurance that I don't really need. I'm paying. Okay.
Yeah, that's kind of the catch. And that's why people will do what you did where, you know, or make the decision to say, you know, look, I'm just not going to pay for Part B. I'm just going to count on that federal benefit is going to be there ongoing.
Okay. All right. Well, that certainly answered that question and shocking news.
Yeah.
Right.
Unfortunately, it's not very clear. And I unfortunately run into this often.
Right. Yeah, no one made that clear 2 years ago. I had actually talked to somebody from Kaiser, and I talked to somebody I thought was from Medicare as well, from the government, that said I had the 63 days from when I retired and did away with my federal plan to enroll in Part B without a penalty. No one told me that it started at 65. So
yeah. Yeah,
right,
they don't view those federal plans as credible.
Okay.
Yeah, sorry, Bob. I hate to be the bearer of bad news.
Thank you, though.
No problem.
I think we might have had another question. I'm gonna send it over to see if. Maybe not. Ernest, did you have a question for us?
I do. Can you hear me okay?
Yep.
My question was, I'm only 63, but I just started taking Social Security. But my question was, when I'm picking either the Advantage or the supplement plans, is it going to be as simple as you go with Aetna or Cigna or United Healthcare or Kaiser? Is it going to be all those companies we're used to that are offering a similar package?
Yep, you're correct. Yep. So all the major insurance carriers, they offer both supplement plans and Advantage plans. I will tell you right now in Colorado, are you in Colorado, Ernest?
Yes.
Okay, so on the supplement side, option one, it tends to be United Healthcare and Anthem. They have the best rates. They've been in the market the longest. They have the lowest, the smallest increases as far as premiums. On the Advantage plan side, the big players in the market are United Healthcare and Humana. Aetna, Cigna, and Anthem also have plans, but the two biggest plans with kind of the most market share are United and Humana on the Advantage plan side. But yes, it is as simple as that. One thing for you to know, Ernest, because you're taking your Social Security benefit,
Yes.
you will automatically be enrolled into Medicare Part B at the time you turn 65. You won't need to do anything. And the reason they do that is because they're so friendly. They just go ahead and enroll you and they deduct that Part B premium right out of that Social Security check for you.
Okay, that was my next question. Where does Kaiser fit into all of this though? My brother and two cousins that are 3 years older than me all said, we looked at all the plans and Kaiser's the best, and that's the end of it. We're going with Kaiser. Is there some particular reason why they would have said that when they all
Yep.
have different needs and?
Yep. So Kaiser only offers Medicare Advantage. Okay,
Okay.
only offers option 2. They've got 3 plans here in Greater Colorado. So they only offer Medicare Advantage plans, and they are the only 5-star rated plan in Colorado. So every Advantage plan is rated by the Centers for Medicare and Medicaid, CMS, and it's a 5-star scale. 1's the worst, 5's the best. Kaiser has consistently over the last couple of years been a 5-star plan. United Healthcare is 4.5 stars. I mean, it kind of becomes splitting hairs, but the reason that they can say that, and that's kind of, and I rep Kaiser, one of their claims to fame is, we've been a 5-star plan pretty consistently in Colorado over the last couple of years. And here's the thing, Ernest, you either love Kaiser or you hate Kaiser. My experience with Kaiser and my clients that I have on Kaiser, they love it because it's a one-stop shop, right? You go see your primary care doctor, you go down the hall, see your cardiologist, you go to the end of the hall and you get your prescriptions filled. So they love it because it's that one-stop shop. The time that people start to kind of not love Kaiser is there sometimes can be waits to see specialists. Not always, but this is, again, just I'm relaying the feedback that I hear. Sometimes there can be waits to see specialists, or what'll happen, and I run into this from time to time, is when somebody doesn't agree with the course of care that the doctor has suggested, where do you go for a second opinion, right? You're stuck in that Kaiser cogwheel, unless you want to pay 100% out of pocket to go out of network to get a second opinion. The other thing that I run into is Kaiser isn't in every state. I've got a lot of clients in Colorado that live half the year in Arizona. Kaiser isn't in Arizona. So they need to be able to see docs when they're out there, but people love it because it's the one-stop shop. It's all right there.
Okay, thank you very much. I appreciate that. That was very good.
Yeah, absolutely.
Alexis, this is Bob again. I have another question if nobody else has anything.
Yeah, fire away.
Well, my question is, I said I do have Kaiser, and you said Kaiser only offers the Advantage plan.
Correct.
And if I stay on my federal plan, to avoid paying right now the 20% penalty, I stay with Kaiser, my federal plan. Does that eliminate me or eliminate the need for an Advantage plan, or do I keep Kaiser and have to get a Kaiser Advantage plan?
Nope, you just stay on what you have.
So I would just, there's not a different plan for me being a retiree, or I just continue to pay the same premiums I've been paying once I retire, or does that change because it's not an employee plan anymore?
It may change a bit when you become a retiree, but it'll probably be pretty similar from what I've seen when people have shared them with me. But yeah, you'll stay on what you have. So you, Bob, are not even eligible for an Advantage plan, because to be eligible for an Advantage plan, you have to have Part A and Part B. So
Okay.
You'll stay on your Kaiser plan, or, again, Blue Cross Blue Shield's the other one that has the federal contract. So you'll stay on that plan. It'll just change over to a retiree plan.
So from a cost standpoint, that actually sounds like a win for me.
Yeah, as long as that plan stays in place and you can continue to stay on those federal employee benefits for all of time, then yes. The only time that you end up getting kind of screwed, if you will, pardon my French, is if that goes away, because then you're going to be paying whatever the penalty is over the years that you didn't have Part B.
Okay, so I wouldn't have to pay for Plan B. So basically at this point, maybe $150 a month for me and my wife, which would be $300. And I don't have to pay for an Advantage plan. So, I guess I'm doing some quick math in my head thinking I'd be paying less staying on my Kaiser federal plan, as long as it stays there.
Exactly. Yep,
And
exactly.
if Kaiser's went away for some reason, could I switch to Blue Cross? Or or does that mean they all go away?
No, as long as they have a plan, you can switch to whatever plan during their open enrollment period.
Without any penalty, right? I'm just going from one federal plan
Correct.
to another base. Okay, all
Yeah.
right, well, thank you.
Yeah,
Gives me a
no
little
problem.
more peace of mind.
Yeah, no problem.
And actually, who would I see to do that when the time comes? I just let Kaiser know I do that, or do I need to
Your
get
HR department.
to a broker like you?
Nope, you're going to talk to it's all going to be internal at work. So
At
you're going to
Kaiser.
talk to yep.
Okay,
Yep,
all right,
it's
thank
all
you.
going to be internal because it's technically an employee plan, and then it'll change to a retiree plan, but that's all managed by the work, right? It's all
Okay.
through work.
All right.
Yep.
Thank you.
Yep.
Thank you.
Yeah, no problem.
Great. Do we have any other questions? I think we'll be okay. I really appreciate the information and you given your time tonight, Alexis. It's always such a pleasure, and I know it's needed information. So thank you so much.
Yeah, absolutely. Well, thank you guys so much for listening. And again, Sharice, thanks so much for coordinating, and hopefully I'll hear from some of you soon. Otherwise, have a great evening.
Thank
Good
you.
night, everyone.
Bye, guys.
Bye-bye.